Hi, Divya. So I understand you and your husband know you're both carriers for cystic fibrosis, and some couples in this scenario might want to decrease their chance of having a child with cystic fibrosis. As we talked about, it's child onset, pretty severe, and so I'm just going to present you with a couple of options that some people have chosen to use. So first of all, have you heard of IVF before? Have any of your friends have IVF?
Kind of, but if you could just give me the basics.
Yeah, so IVF stands for in vitro fertilization. Therefore, we use IVF. A little complicated, but it's basically where we harvest the mother's eggs, and then we collect sperm from the father, and we introduce the two basically on a petri dish. So it is outside of both of your bodies, and then that embryo, that's when an egg is fused with sperm, creates an embryo, and that could be reimplanted in the mom to then carry out the pregnancy. So that's kind of what IVF is. So from there, there's kind of a step two. After IVF, there's another option where when this embryo has been formed, as the cells start to divide, we actually can sample one of those cells and test it for the genetic condition that the parents know they're at risk for. So we could test it in your case for cystic fibrosis, and we'd be able to tell you from the embryos that we test which of them would have cystic fibrosis or not with a pretty high confidence level. So is that something that seems, have you guys thought of that before, heard of that before?
Yeah, that seems cool. So that means I'll definitely have a child and they'll not have CF.
Well, and that's kind of the limitation. It isn't just like a miracle event. Obviously, getting pregnant is still hard. The woman still has to carry this whole burden of we might be able to choose an embryo that does not have the cystic fibrosis gene mutation. However, there could be other problems that happen in a pregnancy, like with all pregnancies, and so therefore it's not a cure-all, but we would just be able to say that embryo that we implant will not have cystic fibrosis. So if this is something you're interested in, we could, I can refer you to a Pgd clinic. That is what it's called, pre-implantation genetic diagnosis. So that is a clinic that they are the ones who will test a cell of the embryo and will be able to tell you if it carries that gene or not. And I could refer you to one that our prenatal clinic has worked with before and patients have had some success with, if that's something you're interested in.
Sounds good.
Okay.